medications and medical conditions. Many people overlook this one, but it's critical. Your internal health always shows up externally. Certain prescription drugs, including blood pressure meds, antidepressants, and hormone treatments, can trigger hair loss as a side effect. So can chronic conditions like lupus, anemia, thyroid disease, or fibroids. How to recognize it: slow regrowth, sudden patches of baldness, overall thinning without breakage, new systems that match when a medication or diagnosis started. What keeps you alive, not what keeps you pretty. That's why internal healing must go hand in hand with your internal routine. You may need to nourish from the inside out before growth fully resumes.
But when she went to the doctor, she had maybe messaged me maybe like a month or two later. She had went to the doctor and she mentioned everything, and the doctor looked at her regimen of medications, and he said that a mixture of them could be the cause. So we always want to keep in mind the things that we're intaking into our bodies, okay? Because these things, like side effects, are real. Like you may be trying to keep yourself alive or keep yourself feeling better, but that may have a side effect. And oftentimes in medications, a number one side effect is, hair loss or, hair thinning or things like that. So you want to keep that in mind. And if, that is the cause, you maybe talk to your physician and say, hey, I'm having this side effect. Is there any way I can suppress it? Or is there an alternative? Can you give me some guidance? Because if your hair loss is being attributed to something that's on the inside, it's going to be very little that you can do on the outside to stop that, if that makes sense.